Hello, Jocelyn. We just finished our history taking, okay? Now we're going to start our physical examination of the lung fields, okay? So the first thing I'm going to do is I'm going to inspect your chest wall, okay? Now what I'm looking for is any abnormalities. Now that can include the shape of your spine if you have any scoliosis or any kyphosis, okay? Or barreled chest. Typically people with COPD, they'll have a barreled chest, okay? I don't notice any kyphosis, any scoliosis, or any barreled chest. The next thing I'm going to inspect is respiratory effort and movement, okay? Now, abnormal respiratory effort can include retractions, which are common in patients with asthma or pneumonia, okay? Use of accessory muscles with also with the same type of patient group. And then the next thing we inspect is respiratory rate. If you're breathing fast or if you're breathing slow. Now I've been taking a look at your respiratory breathing this whole time and I've noticed it's about 18 breaths per minute, so it's normal. Next thing we're going to move on to is palpation. Okay? Now for palpation, we're going to be looking at respiratory excursion, which will measure the diaphragmatic movement of your chest, okay, and see if there's symmetry. We're also going to be doing tactile firmitus, and this will measure any vibration in your posterior lung fields to check for any consolidation. All right, and then the third thing that we're going to do is costal chondral tenderness, and this will be done anteriorly. Okay, so can you go ahead and turn posterior to me? And we're going to start off with the respiratory excursion. I'm going to go ahead and put my hands on your hips here, okay? And I'm going to have my thumbs sticking out like this. And then what I'm going to have you do is take in a deep breath and then out. In again, out. Okay, good. So here we're checking for any, pleural effusion. Could be an indication, a pneumothorax if one side is rising and the other one is not. Okay, the next thing we're going to do is the tactile firmitus. So for this, I'm going to place the ulnar side of my hands on your back, and I'm going to have you say 99. Whenever I touch you, you're going to say 99, okay?
99, 99, 99, 99, 99.
Okay. So if there was no vibrations, then that could indicate any consolidation into your lungs. So you go ahead and turn back towards me anteriorly, please. And we're going to check for costal chondral tenderness, okay? I'm going to check the intercostal areas for any tenderness or pain, okay? Any pain?
No.
Any pain?
No.
Okay? And any pain?
No.
Okay. So the next thing we're going to do is going to move on to percussion, okay? And we're going to percuss the lung sounds, okay? Both anterior and posterior, okay? And we're going to do diaphragmatic excursion, okay? And this, what this entails is that we're going to measure the distance on inspiration, okay, of your diaphragm to the distance between your diaphragm when you're on expiration, okay? So first of all, we're going to go ahead and we're going to percuss the lung fields, okay? And I'm going to start here anteriorly. All right, and I'm going to listen for resonance, okay, in your lung fields. Okay, so I've heard all the resonance in the areas that there is resonance, and then dullness in the lower areas where your liver and your spleen is. So now I'm going to have you go ahead and turn posterior, and I'm going to also percuss those regions, okay? Okay. And then also lateral. All right, good. Okay, so now we're going to do diaphragmatic excursion. So I'm going to mark or visualize when you take a couple breaths and then you're going to breathe out. Not yet. Just in a second here, I'll have you breathe out all the way, and then I'm going to have you hold it. I'm going to mark that area. Then I'm going to have you take a deep breath in and hold it, and then I'm going to mark the other area here visually, okay? So go ahead and just take a couple regular breaths, and then breathe all the way out and hold it. Okay, you can breathe now, take a couple of breaths, and then when you're ready, I'm going to have you take in a deep breath and hold it. Okay, so it was a distance from about here to here, which is roughly about 3 centimeters, and so that's normal. Okay, so go ahead and turn around for me, Vessel. And now we're going to auscultate, okay? The lung fields anterior, posterior, okay? Lateral, and the apices, okay? So I'm going to go ahead and start anteriorly. Okay, so this is bronchial breath sounds here. Okay. So over here we have bronchial, and then as we get lower down here we have bronchial vesicular sounds, okay? Here we're going to go ahead and do this posterior, same thing. Using the diaphragm of my stethoscope. So go ahead and take in a deep breath. Okay, so posterior, when we're listening here, we're going to be listening for bronchial sounds, bronchiovesicular, and then vesicular sounds down here in the lower regions. Now, if we heard bronchial sounds in other areas, that would be an abnormal sound. We could be hearing wheezing, which could be an indication of asthma. Any crackles, fine or coarse crackles, could indicate fluid accumulation in the lung regions down here. And then next we're gonna auscultate the apices. So just turn around for me here, Jocelyn, and we're gonna auscultate the apices, which is right above the collarbone here. And we're going to use, I think, bell shape here. Okay. And everything sounds good and healthy. And thank you very much for this assessment. Okay, Jocelyn? Talk to you later.